Hello and welcome to the clinical case discussion class focusing on differential diagnosis approaches. For those of you here, I want to tell you that this is the turning point in dentistry. For those who don't know me, my name is Andréa Melo. I am a dentist graduated from URJ. I have a master's degree in material science, a doctorate in restorative dentistry from URJ, and I am the founder of the International Society of Bruxism. That's right, there is an International Society of Bruxism because it's the fastest growing problem right under our noses in our dental offices. Everyone is breaking teeth, everyone is grinding their teeth, and we need to definitively enter this field to become a reference. Thank you. My goal as a dentist is to teach you to become a reference in your region, increasing your revenue with great integrity through differential diagnosis, treatment, and control of bruxism. And this is for you who don't charge for consultations. This is for you who work with health insurance. This is for you from all areas of dentistry. You're here at this event in this free and open class, but there's a 100% online free event happening so that you can become that reference dentist in your region. How can you do that? How do I teach you that? There are 3 free classes. You need to sign up. If you're here on Instagram, type the word Bruxism to receive the link in the description. Or on YouTube, Facebook, you can access it through the link in the video description. Now pay attention. You need to enter your best email and your WhatsApp to receive the event, and also to receive all the materials I prepared for you. Advanced Dentistry Week. Be careful with scams, because there are people who might pretend to be me making miraculous offers and sending you a super cheap course for you to buy. That's not me. Check the official numbers in the WhatsApp group. Only the group administrators will send messages on my behalf. So be careful with scams. I want to bring you a series of scientific studies, a series of articles, a series of fresh science applied to clinical practice, because I believe in professors who actually practice. A professor who doesn't practice is a theoretical professor who is distant from the patient and no longer really knows what life is like in the field, life in the dental chair. So in the first class of the Advanced Dentistry Week, I told you the 4 reasons to become a reference in bruxism in your region. I'm going to do a brief review. Class 1 was released on Monday. Today is Thursday. I'm going to do a brief review about the importance of actually being the reasons for actually being a reference dentist in bruxism in your region. So there is a high demand for bruxism treatment and a low supply of professionals. The first reason is that bruxism is the fastest growing problem in our country. That's right. According to the WHO, we have a bruxist population of 40%. 40% of the Brazilian population has some type of bruxism. The average is very high. The average is very high. Pay attention. We have, how many dentists do we have in Brazil today? 426,000 dental surgeons. We have more dental surgeons in Brazil than in all of Europe. Pay attention. Now, despite the large number of dentists, there are very few who actually know how to diagnose, treat, and manage bruxism. Do you realize that not even 5% of that number of dentists know about and are considered experts in bruxism? Do you know why I'm telling you this? I've been living this for years. Think of 3 dentists in your area who are experts in bruxism. Think about it. It's not TMD, it's not ortho, it's not bruxism. There aren't any. I gave you a few seconds to think so you could see the size of the opportunity. You can't turn a blind eye to this anymore. And look, your patient is searching for the word bruxism on Google. This blue graph represents bruxism and the red one, veneers. Did you realize that bruxism is now being searched for more than veneers? It crossed the line. And when we talk about longevity, when we talk about restorative treatments, when we talk about any type of dental treatment, bruxism doesn't go hand in hand if you don't treat the bruxism. Nothing you do in your office will last if you don't treat bruxism. Andrea, how do I treat bruxism? Come with me. Let's go. I want to show you clearly that in this chart, the average has gone up. The blue line is going up. See, it's going up. People are searching for bruxism. People want to know who the references in bruxism are. And I want your name to be there because those who get the differential diagnosis right truly become a reference. The patient comes in lost. The patient doesn't know they have bruxism, doesn't know what causes their bruxism. And often they find a dentist who is also lost. But what do we see in our practice? When treating patients, that more and more you see this kind of fracture, this kind of crack, these kinds of problems related to pain. Sometimes your patient comes in with a pain that you can't figure out. And over time, you discover it's a fracture, it's a crack. What a big problem, right? Reason number 2, all specialties can and should add bruxism to their daily clinical practice. There's a myth that bruxism is only for rehabilitators, for orthodontists, for oral surgeons, or for TMJ specialists. This myth exists. If you're an endodontist or a general practitioner, you shouldn't treat bruxism or even get involved with bruxism patients. Many times you refer the patient to someone else to make a night guard because you don't want to deal with it yourself. But what I want to tell you is bruxism isn't just for TMJ specialists. Bruxism isn't just for orthodontists. And bruxism doesn't necessarily have to be treated by a rehabilitator who only works on teeth, even if they're restoring the patient's vertical dimension. What do I want to bring to your attention? When we look at the evidence on bruxism, we're not making a differential diagnosis. I saw that there's where, so I know there's bruxism, period. That statement is wrong. If you saw that there's where and you concluded that the patient is currently bruxing, in reality, you didn't consider that this bruxism might have happened in the past. I don't know if they're doing it now. And that's exactly what I want to talk to you about today. I don't know if at this point in their life, they're bruxing. I don't know. When will I know that? Now, I do know what the impact is on my life as a dentist if the patient is bruxing. And I brought literature for you. Take a look here. Analysis of the causes of implant fractures. An article for you. Occlusal overload, the conclusion. I brought the summary of the conclusion. Occlusal overload caused by bruxism or by an inappropriate occlusion, or the combination of these two factors, inappropriate occlusion plus bruxism, chaos. What is it? In the first year after implantation, it is in fact, after the implant is in function, the main cause of fracture, of failure. So we know that implants are extremely susceptible to failure when placed in a mouth with bruxism. I'm not just making this up. I'm telling you science with scientific approval. I'm not going to throw away my doctorate by saying something that doesn't have scientific plausibility. Pay attention. Endodontists, why do you need to invest time in this? You're an endo. Why do you need to invest time in this? First, microcracks increase the degree of infection and the possibility of retreatment. Did you know that? It's in the literature too. Second, preventing complications after these treatments is essential, and to prevent these complications, you need to maintain the structural integrity of the nexus. Period. Maintain it afterwards. Third point, many times the patient comes in with pain and necrosis caused by bruxism. So how are you going to treat only the consequence, which was necrosis, or will you bring a differential diagnosis for the pain, which besides necrosis, the cause, we already know this. I'll bring you an article about it here. Besides pulp necrosis, we also have an aggravating factor in the differential diagnosis of pain, which can be mistaken for facial pain due to muscle issues. So look, hypertrophied muscles because of bruxism, for example, a muscle nodule caused by bruxism, for example, all of this can happen. And you are a dentist, people come to you because of pain, they ask you about pain. So intense bruxism is there, look, scientific article from 2022. Intense bruxism is capable of causing apical periodontitis. In other words, it can really cause problems. There are cases of necrosis because of bruxism. So what are you going to do? Oh, I'm going to give them a mouth guard. And I know that most people here have already given a mouth guard to their patients. Why? Here's the research. 64% of the people here have already given a mouth guard to their patients. And I want to tell you the following. Is there a problem with giving a mouth guard to the patient? It depends. And I'm going to show you that there really is a problem with giving the wrong mouth guard to the patient. Apneic patients, for example, that's the first problem. Second problem, if you only give your patient a mouth guard, you're not treating the cause. And by not treating the cause, what are you actually making happen? The continuation of the problem, the continuation of the quote unquote disease. So when I think, oh, I'm an endodontist, I only do endo, but I received a referral. Okay, but the person who referred the patient doesn't have the perspective of bruxism in this patient, and you are the one responsible for the differential diagnosis in this case and for shedding light on the reason for the necrosis. You are also responsible for diagnosing bruxism. So we have to understand that this is part of our daily routine period, which is the second reason. All specialties should incorporate this into their daily practice. If you're an orthodontist, for example, many patients have difficulty sometimes using an aligner because of clenching, because of bruxism, or they develop facial pain, for instance, that they didn't have before due to an aligner exacerbating a bruxism they already had. So is it possible to keep the aligner? Yes, if you actually know how to make this differential diagnosis of bruxism. Third reason, you don't need expensive equipment nor new software. You don't need any of that. You don't need to invest in absolutely anything structural for bruxism. In any area of dentistry we go into, we have to invest in materials and instruments. There's always some investment. With bruxism, there isn't. You don't need it. Look how interesting that is. You can simply get started without spending a single cent. And you might be thinking, oh, but I wanted to buy such and such thing. I know that instruments are important, materials are important. I have all of that. Now, these materials, they give you a return in the long run. They don't give you a return as soon as you buy them. On the contrary, at first they're an investment. You take money out of your cash flow and put it there, but it doesn't come back quickly. Now, understanding, practicing, and becoming a reference in bruxism, that's short-term because you can apply it tomorrow with a patient who's already in the chair. You can apply it tomorrow morning with a patient who's already scheduled in your agenda. And in lesson 2, I showed you exactly how you actually make this differential diagnosis. In lesson 2, I showed that. Lesson 2 was released yesterday. If you have not watched it, when you finish here, go watch lesson 2 because I showed in practice how you do this. Fourth reason, ease in closing treatment plans for patients and having patients return. So I have an easier time closing when I stand out, when I am a reference, when I bring the answer to a problem the patient has that no one else brings. And when I show it to them, I show it with something tangible. I'm going to teach you this. And this patient actually comes back, they connect with you. No one buys from someone they don't feel connected to. And that's exactly why we need to connect with our patients. In lesson 2, I taught you exactly how Bruxism can increase your revenue, even if you do not charge for the first consultation or if you accept health insurance. So when you finish here, go to lesson 2, because I talk about all areas of dentistry. And I'm not saying you need to give up your specialty, not at all. Lesson 2 shows you whether you're a general practitioner or a specialist, how to enhance this, how to boost your field with Bruxism. Bruxism becomes the cherry on top. It's something common to all specialties. Restorative, prosthetics, vertical dimension of occlusion, restoring the vertical dimension of occlusion, veneers, general practice, orthodontics, restorative, implants, TMJ, headaches that can happen because of Bruxism. And you, any dentist from any field, can identify this headache, can discover something your patient has because of Bruxism, something they never realized could be connected to the dentist. In other words, right now you have a great opportunity to stand out. And I'm not saying here that you need to make big investments in marketing, big investments in social media. No, no, no. How many patients do you see on average per day? Most people here see between 1 and 5 patients every day of the week, 5 times a week, or maybe 4 or 5 times a week. This is the case for the vast majority of people here. So if you see 5 patients a day, over 5 days or 4 days, you see an average of 20 to 25 patients per week. This is a very important point. You are in front of 25 people every week, and you are in front of 100 people every month. Look at that, 100 people every month. Have you ever done that calculation? You can impact 100 families every month. You can impact the quality of life of these families every month by doing what needs to be done with integrity. And besides that, beyond this impact on those 100 families, you will also ensure an impact on your own family because you will increase your revenue with a lot of integrity. You will have more cash flow to spend more time with your children, with your grandchildren, with yourself, with your health. So the commitment is to your patient's health and to your own as well. I mentioned 5 patients per day. That's a calculation that's easy for you to achieve. So tomorrow in lesson 3, I want to show you exactly the step-by-step process for closing these bruxism treatments in the very first consultation. I'm not talking about selling mouth guards. At no point did I say anything about selling mouth guards. The mouth guard is part of the treatment. The mouth guard works. There are 5 different types of mouth guards. The mouth guard works, but it's not the entire treatment. So tomorrow is the most important class of the whole week. You can't miss it. Set your alarm so you don't miss this class, because I'll prove to you that it's possible to close these treatments in the first consultation. There will also be a practical part in the class. You'll see how to do it, how to present it, how you actually do this to deliver it to your patient. Often the patient doesn't understand why they have to pay for a first consultation. If you haven't had this philosophy from the beginning, or if you still haven't implemented it, sometimes you might be living off small procedures. Oh, I do a little scaling here, a small filling there, a class 2 over here. And in the end, this is very physically and emotionally draining because you have to be in front of several people all day doing small things. And often you're not delivering the health that this patient needs, not even oral health. So when you take on a mouth like this, if you don't really have a 360-degree perspective, you get lost. I know you get lost, but how many mouths like this do you see every day in your office? And it's only going to increase. So I want to bring you the reality that this type of case is very common and what you can do about it. What is your role as a healthcare professional? What is your role as a healthcare professional? Who will be a reference? What is your role with integrity that increases your revenue and often frees you from being overworked at the clinic? So pay attention. 54% of the people here don't charge for consultations because many times you're afraid to charge and the patient won't come and you'll lose the opportunity to make a sale. But the differential diagnosis, in fact, allows you to generate revenue in the first consultation and gain time to plan what this patient actually needs. I know it's not overnight that you start charging for consultations. I know it's not overnight that you leave a health insurance plan, and I don't even want you to do that right now. I just want you to understand. Pay attention to what I'm explaining to you. Understand what I'm telling you so that you can see the patient from a 360-degree perspective, for example. Your approach will change and the quality of your care will skyrocket. You will make a leap forward. In lesson 2, I explain in a totally replicable, simple, and unique way a step-by-step guide to the methodology of differential diagnosis, treatment, and control of bruxism. DTC, that's the method. Why? Because it took years of study, years of application, and years of replication. Today, with this methodology, we already have students in more than 20 countries applying it successfully. Do you know why? Because it was studied and tested. and applied. So I want to bring you each one of these steps. First step, first pillar, differential diagnosis. Step 1, 360-degree form. The right forms, I talk about all of this in detail during Advanced Dentistry Week. Which ones are they? How do you read this form? How do you apply it? How do you perform an extraoral and intraoral evaluation? How does this evaluation actually impact your patient conversion? How do you carry out these two specific complementary exams, the diagnostic wax-up and a polysomnography that you can offer in your practice, both of which are paid? Differential diagnosis is paid, and I'm going to share some of them with you now. And how do you provide the report for this? How do you finalize this process and provide support to your patient? Andre, I've never heard of the diagnostic wax-up exam. Here it is. This is the diagnostic wax-up exam. I published this in 2019. It's an ultra-thin plate. You give the patient a completely red plate. The patient sleeps with this plate, and it wears down over the course of the night, showing the movements he made, what the intensity was, how many teeth he actually touches during the night, which teeth are under occlusal overload during the night. Imagine you're going to place the implant exactly on the tooth that has a greater overload. That's a problem. So even if you don't charge for consultations today, even if you work with health insurance, this is an opportunity. This is the x-ray you need from your patient to do a restoration, just like you need a good x-ray to do a root canal. This is the nighttime x-ray. I need to know how the patient sleeps. Why? Because he's clenching his teeth. I showed you 40% of the population is a lot of people. And what do I see in this image? I see that he has more of a clenching type of bruxism. There's little movement on the canines, but he clenches more. He clenches more than he grinds. There is a methodology for us to read this exam, and this methodology is very important for you to qualify. If the patient has mild bruxism, you shouldn't just abandon this patient with mild bruxism. Look at this case where a canine is darker due to trauma. This is related to bruxism. And there's an exostosis right there, exactly at the circled spot where there's bone growth. Don't abandon the patient with mild bruxism. Moderate bruxism. With moderate bruxism, we need to be careful, because this patient is at high risk of fracture. In this case, the patient did fracture. This patient is at extremely high risk of dental damage or damage to their restorations, implants, or root canals. This doesn't have longevity. And we can qualify this bruxism with the diagnostic splint exam. You might be asking yourself, Andre, if I can see the worn teeth, why do I need to do this diagnostic splint exam? I don't need to. You might be wondering. I want to tell you, you can't know. If the patient is currently bruxing, or if the bruxism happened in the past when you're looking at worn teeth, and you also can't know the intensity of this bruxism, and that's exactly why the exam will help you confirm your diagnosis. The exam is essential for you to reach a diagnosis. Now, the exam has a huge added benefit, which is the patient's engagement. The patient looks and says, oh, I did this at night. If I did this at night, I'm going to wear down my teeth. So this is the moment when you are facing a classification of bruxism, and this is the moment when the patient connects with the treatment. If bruxism has happened or is happening and the patient doesn't have worn teeth, why would you do the diagnostic splint exam? You can actually detect bruxism even without worn teeth. Eccentric bruxism, atonic bruxism, the clenching type, this kind of bruxism doesn't cause tooth wear. It involves more clenching than grinding. And so you can differentiate the types and the intensity of the problem, whether this bruxism is active or not. And you are able to monitor this patient. Looking at a mouth like this and saying it has bruxism is almost ridiculous. Anyone can do that. An advanced case of bruxism in a 28-year-old patient who has already worn down all her teeth. My question is, has she never been to the dentist? Of course she's been to the dentist before. She's been to several dentists already. And my question is this: couldn't this have been intercepted when it was just starting? If an exam had been done, if a differential diagnosis had been understood, why let it get to the point where a 28-year-old patient needs oral rehabilitation? Wasn't it supposed to be like this? It wasn't. But what happened? The dentist didn't notice. No differential diagnosis was made. No intervention was done at the right time. They didn't know how to treat bruxism, because there is treatment for this. They didn't know how to treat bruxism. This applies to any differential diagnosis, and bruxism is something any clinician should handle, because the patient will come in before it gets to this point. She saw several dentists. So, as I said, most of you have already given an occlusal splint to your patients. And be careful, you might be giving them the wrong splint. Look here, I brought an article showing you exactly the effect of occlusal splints on obstructive sleep apnea. For those who don't know, obstructive sleep apnea is when oxygen saturation drops, the patient stops breathing for a few seconds, and their oxygen levels fall to significant lows. What does this do? This causes them to have a microarousal, fragmented sleep, and to have a bruxism episode when they wake up. Why do they wake up? Because the brain understands that they're dying, that they're suffocating, and adrenaline, come on, let's wake up. the heart races, the patient wakes up. This causes the patient to develop a serious problem over time. No one is going to die from apnea in the first year. That's not it. Now, over time, this will worsen diabetes, worsen cardiovascular diseases, and aggravate a series of other systemic problems. And the occlusal splint, from the Michigan splint to the flat splint, look what happens. It pushes the jaw further back, causing the patient's apnea to worsen. So I just explained to you what apnea is and told you that the flat splint, the Michigan Bruxism splint, the so-called relaxation splint, which we don't even call a relaxation splint anymore, is bad for patients who have apnea. Maybe you're thinking, Andrea, this is too much for me. I don't want to deal with this right now. I understand you. I swear I do. But dentistry has changed, and patients today have the internet. Nowadays, when they look something up, it's not CobiMed. They're going to Google. CobiMed is for dentists to look up. And I'm actually here to go into CobiMed and bring you the summary. That's what Advanced Dentistry Week is all about. It's about squeezing the science, squeezing the clinical application, and bringing it to you all digested. And that's why you need to watch classes 1, 2, and 3, which I'll release tomorrow. Why? Because there could be many more classes. But I brought you the summary so you can understand the methodology, how you can apply it in your daily practice, and how you can become a reference in your region. What is the path? So what do we have here? A patient who goes on Google to look up bruxism. A patient who goes already see, for example, that there is a connection between apnea and bruxism. So here I brought you where bruxism happens during light sleep. And do you know what else is in this article? It shows that there is no relationship between occlusal factors and bruxism. So if you're still in the habit of giving out mouth guards and doing occlusal adjustments, thinking that's bruxism, that's how you treat bruxism, I'm sorry to tell you that time has passed. You are out of date, and this is the time to update yourself. So light sleep, which is non-REM stage 2 sleep, is a light sleep. This light sleep is where most episodes of bruxism occur, okay? Here's another fresh article I brought for you. The last few years have been the years with the most publications about bruxism. Bruxism wasn't a very relevant topic. That's why in our undergraduate studies, no one learned about bruxism. And that's why when you think, wow, I delivered so many occlusal splints to so many patients, did I do them harm? For those who have apnea, yes, but it's over, you didn't know. Now it's a new moment. It's a transition where the dentist becomes the protagonist, where the dentist becomes relevant and starts to take on their role as a healthcare professional. I wanted to bring this to you. Take on your role as a healthcare professional. You're not a splint salesperson. You're not a splint salesperson. Pay attention. When we move on to bruxism treatment, we have 4 other stages. Pre-sleep treatment, which is preparing for sleep routines and patients. The custom splints depend on the type of bruxism, whether it's primary or secondary bruxism, whether there's sleep apnea, whether it's diurnal, nocturnal, or both. Sometimes there are patients who need 2 different splints. Supplementation, which is not prescription medication. On the contrary, it's about supplementing your patient's sleep, emphasizing to them the importance of deepening their sleep and understanding that patient's sleep. An occlusal adjustment. Andrea, you just said that according to this article, there's no relationship between occlusion and bruxism. So how can one stage of the treatment be occlusal adjustment? I'll explain it to you. If I have a loss of canine guidance, do I need to restore it? Yes, you do. But I need to restore it and do all the other steps as well. Because just restoring a canine guidance won't solve the patient's problem. So restoring the canine and giving a splint isn't wrong. It's incomplete. And if you restore the canine to give a splint and then blame the patient when it breaks, then sorry, that's not ethical. That's not right. So science has already proven it. We have related disorders. We have related issues. I can't call bruxism a sleep disorder. No, I'm not calling it a sleep disorder. But for example, when I associate it with apnea, then I have another problem. When I associate it with a medication the patient might take, which increases bruxism, I have another problem. So it's science applied to clinical practice. And what about control? Bruxism control is when we actually treat the patient. I took the patient from point A, brought them to point B, and from that moment on, they are being controlled. So control is not about adjusting the mouth guard. Oh, I'm going to control it. I'm going to adjust their mouth guard every 6 months. Sometimes you won't need to do anything to the mouth guard. Sometimes you will. The more stable the patient is, the better they did in the actual bruxism treatment. In the steps I just showed you, the better they did, the fewer dental and mouth guard adjustments they'll need during follow-up visits. Why is that? Because sometimes I'll supplement, sometimes I'll remove the mouth guard, I'll make changes, I'll check how the patient's sleep is, I'll look at the patient's markers. So you have to look at the patient as a whole. You have to look at the patient because the patient has changed. So it doesn't mean that I have a well-done restoration and that this patient is actually healthy. No, there's no connection. We have to understand that a restoration is one thing, bruxism is another, and restoring this patient's health is something else, and you are the qualified professional for that. Look at what happened in this student's life. This student was truly something special that happened. Why? Because she is committed. She takes care of the patient. She has always cared, always had this perspective of looking after the patient. She is a prosthodontist. She has her own practice, but she was going through a tough time because she worked with insurance, saw a lot of patients, one after another, and didn't feel fulfilled when it came to truly caring for the patient. She was unhappy in her profession, you know? She didn't know how to do anything else. She liked dentistry, but she was unhappy in her profession. And I'm sure you chose dentistry for a reason, to take care of people too. Otherwise, you wouldn't have gone into dentistry. You would have studied economics. Pay attention, many times you're just heading in the wrong direction. But it's not that your purpose in dentistry is over. It's just the direction that's wrong. And Luciana Porto Guimarães from Belo Horizonte, she was heading in that direction. So she learned about the DTC methodology, grabbed onto it with everything she had, and transformed her clinic's routine. Look at what happened to her.
I went from earning 8 rays, which was what I got for the first appointment through insurance, to 900 rays, which is the package I sell for the differential diagnosis of bruxism, and it includes all the steps of the diagnosis. My office doesn't have any openings this week, and next week is fully booked too, because there are so many patients I'm seeing. It was like a light from God for me, because it was a completely different direction, something I never expected could happen. And today, I'm a reference dentist for bruxism here, and I have security and confidence in my work, knowing that I'm doing the best for my patient.
She used to have appointments that paid 8 rays through the health insurance plan. Just imagine how many patients she had to see to pay the bills at the end of the month to break even with each appointment at 8 rays. And she was starting to feel unhappy because she didn't have time to do what she really wanted, which was to actually take care of her patients. So she realized that now her schedule is full. She left the insurance plan, and today she's able to give her patients the best care, regaining her original purpose in dentistry. If you haven't watched lessons 1 and 2, when you finish here, go back and watch them on fast forward, because these lessons will go offline by Sunday. Remember, doing the same things and expecting to get different results is madness. So doing the same things will lead you to the same results. Doing the same things and expecting a different result is madness. So I don't want you on that boat of just letting life take you wherever, thinking everyone's clenching their teeth anyway, and there's nothing to do, just sell a mouth guard and that's it. No, that's not the profile of a dentist who truly cares for their patients. That's not the profile of a dentist who is a healthcare professional aiming to be a reference. So now I'm going to bring you real discussions, real clinical cases from my students using a differential diagnosis approach. Okay? I'm going to focus more on differential diagnosis in these clinical cases. All these cases are created and put together by my students, just like you, happening right now in your own chair. And I'm sure that nothing I'm going to show here doesn't happen in your daily practice in terms of patients. The same patient who comes to them, comes to me, comes to you. So the student's template, I give this template to them and they fill it out. Write in the data themselves, add the photos, and send it to me so we can discuss it in group mentoring sessions. I brought the case of this dentist who works in a very new area of Rio de Janeiro and another one who does not. So pay attention. This works for everyone. The patient came to her for a routine exam and before starting treatment, lost a tooth due to a fracture. In other words, the patient was outraged because he lost a tooth to a fracture, upset, probably sad, and 15 days later, he lost another tooth. Can you imagine? The guy lost 2 teeth in less than a month because of fractures. So he reacted well when talking about the diagnostic plaque test because no one had offered him a test capable of actually detecting what he did at night. So he was very worried. She charged 690 rays for the diagnostic plate. 690 rays. Now pay attention. I just talked about Luciana, who was seeing patients for 8 rays on the health plan. A consultation, 8 rays. Guys, 8 rays is almost not even times less than 690 rays. What does this mean? If Luciana had kept her head fixed at 8 rays and 0 cents, thinking that there was no other way in life, maybe you'd think, I'll never be able to get out of this situation. She wouldn't have understood this methodology. And if Elizabeth had also been focused on this issue of the region, for example, she wouldn't have offered this differential diagnosis exam to that patient who wasn't from the upscale area. And he paid 690 rays. So don't limit your patients. Don't do that. Have the knowledge to show them the importance of this differential diagnosis. And then, yes, you'll be able to show them its value. Because cost is one thing, value is another. When your patient sees value in you, they pay. Now, does your patient see value in you? That's a question you need to ask yourself. Do you see yourself as valuable? Maybe you don't feel that confident yet. But I want to tell you that with the step-by-step, you can actually do things with confidence. Something with predictability, with a step-by-step process. And as I told you, the methodology is validated in 20 countries. I didn't start yesterday, and I'm not going to finish tomorrow. And I want you to understand this once and for all. You are not just a splint seller. There is more for you who want to deliver to your patient differential diagnosis pillar. I showed you a bit earlier now in the live, the right forms with the right questions, extra and intraoral evaluation, complementary and differential exams, support closure. What are these forms? The forms are there. I explained all of them in lesson 2. Every single detail that we need to observe about the patient is in these forms. Do you know how much it costs you to ask the right questions? Nothing. Because the patient can fill this out at the reception desk. So you don't even spend your consultation time on it. Be careful. You might be believing that this is too much for you and you'll end up sabotaging yourself. Don't sabotage yourself. I want you to take on your role as the protagonist, as a healthcare professional. And this patient then with 2 fractured teeth from an area that wasn't the most upscale in Rio de Janeiro paid 690 reais for the diagnosis. That's the difference. And peace, well, do you know what happened? Obstructive sleep apnea syndrome in this patient. Where? In the complementary differential exams. So if you simply give a bruxism splint to this patient, you're actually harming them. Whoa, now that's a problem. Because it's not just indifference, it's actually causing harm, often, to a patient. So the complementary differential exams show what you're seeing there. That the dye is more pink, which could be related to some kind of reflux. What else is it showing? That he's making a lot of contact with his front teeth, that he's worn out the molar area. So it's showing a reading of what's actually happening in the clinic, which was what? He lost 2 teeth, dental crack syndrome. Be careful, this is going to happen sooner or later in your office. And you might run out of options and the patient could get upset and leave. You know why? Man, I've been taking care of my teeth with you my whole life. I broke it and there's nothing you can do. So are you going to blame him? Are you going to say that's just how it is? It's going to break, just use this mouth guard. Goodbye. No. Remember, I brought an article here. Apnea and bruxism often go hand in hand. And apnea is fundamental for control. It's essential to control apnea in order to manage hypertension, cardiovascular risk, and various conditions like diabetes. So reputation and integrity go hand in hand with the care and plausibility you provide to this patient. I don't want you to instill a bunch of fear in them. Oh, your tooth is going to break, huh? If you don't use the mouth guard, your tooth is going to break, huh? And it'll be your fault, okay? Not mine. No, you'll have to pay again. What is this, people? Are you a healthcare professional or what? Broaden your perspective. Broaden your perspective because you are capable of more. You can deliver more to your patient with differential exams. And I think it's amazing. Someone like Sergio, who's been deformed for 40 years. I don't know how many years you've been deformed, but Sergio has 40. That's a lifetime in dentistry. It's a lifetime without ever leaving dentistry. Just think, he has patients who have been with him for 20, 30 years. You've already developed a relationship with this patient. If this patient has been with you for that long, it means they fully trust you. And you are the one responsible for bringing them the latest scientific updates. The updates on what's happening in the world today. The patient has changed, the profile has changed, the world has changed. Society is completely different now. And Sergio embraced this and understood even more. Do you know what he understood? That he could retire without actually retiring. What do you mean, Andrea? He wants to stay at the office because he wants to keep active. He doesn't want to be at home all the time, but he's often tired. His back, his eyes, his arms, of course. 40 years on the dental stool, 40 years on the stool. Who isn't tired of the stool after 40 years? No one. So bruxism is a door that opens so that, in fact, you can stay in the office, but without so many hours bent over the patient. Why? Because the pillars of differential diagnosis, treatment, and management don't require so many hours on the dental stool. So you become your patient's health promoter. Have you ever thought about that? A dentistry of reference, with you being that reference, improving your patient's quality of life and being paid for it, and well paid for it. So Sergio had this vision, and look at what he implemented.
I'm 69 years old, and I've been in this profession for over 40 years. Before I learned about Andrea's method, I used to just put up a little sign because that's all we had at the time. Now I'm reaching out to many of my former patients, bringing them back to my office with a new proposal for treating bruxism. Currently, I consider myself an authority when it comes to solving these cases of bruxism.
Very few people do it, and it's extremely valuable. Not even 5% of dentists do it. So Sergio saw the opportunity. Maybe until now, up to this moment, you haven't realized that the patient is already in your chair. Maybe you just weren't seeing it. Maybe you still don't see it, but starting tomorrow, I'm sure you will. You won't be that dentist with a blindfold over your eyes. Do you know why? Because You'll start to see the evidence of bruxism. You'll see the possibilities to go further with this patient. I know many times you'll think, I don't know how to treat it. I don't know how to go beyond the mouth guard. That's why I'm here to help you. Right now, I'm here to bring you what? Parameters to show you that it is possible. To actually bring you a science-based methodology that makes it possible. So is it innovative? It is innovative, but it's possible. And you, no matter your age, no matter how long you've been practicing, 20 years, 10 years, 5 years, 40 years, you fit into this bruxism profile because the patient is experiencing bruxism and you are the one responsible for bringing science, solutions, and practical application to them. Another case, Kemper from Rondonópolis in Mato Grosso. Kemper is an oral and maxillofacial surgeon, has a large clinic, a surgeon, and his clinic offers all specialties. Kemper really likes diagnostics. Kemper is super dedicated to his patients as well, but he does a lot of surgeries. So for him, he could have just said, man, I'm making money with surgery. I'm on a different path. Maybe this isn't for me. But he has a commitment. My question for you today is, what level of commitment do you truly have to your patients? That's a question you need to ask yourself right now before you give up and leave it for later or for another time. What level of awareness does your patient have that bruxism can indeed be a major problem in their life and that you thank you? What is the level of commitment you have to knowing how to treat this patient and improve their quality of life? So this 58-year-old patient came in with sensitivity, another detail that's starting to happen a lot, sensitivity in the office, right? She often feels a bit of sensitivity in her face. And as it's written there, it's actually a bit of pain in the face. And when she talked about the diagnostic splint exam, the patient reacted calmly. She agreed to the exam, yes, without any problems. Did you charge for the diagnostic splint? He did charge, Kempner. He gradually increased it. Do you know what he does today? The diagnostic package, both complementary differential exams. And he charges 1,250 reais for the diagnostic package. And what was the result? Mild and centric bruxism. And he wants to show the case here so we can discuss it and outline the treatment plan. So pay attention. She has sensitivity and she has facial pain, right? Sometimes. And this is a patient who actually has canine guidance. Hey, does every bruxism patient have wear? No. There are clenching patients who don't have wear, but clenching is often really related to muscle pain. That's one point. Second point, I don't always need to reestablish canine guidance. Guys, this patient hasn't lost canine guidance. But what's a super important point about this patient, even though she has the canine? Especially the lower ones, they're super intact. She lost a little bit of the canine on the left side. This is a patient, look, she lost a bit on the left side. When the patient shows the whole diagnosis, when we show the whole diagnosis, when we understand this patient's diagnosis, when we bring in the diagnostic splint exam, what do you notice in this exam? What do you notice in this exam? That she clenches her teeth with some small marks there on the palatal side of the molars, and that she does what else? There's also some wear on the canines and large premolars on the buccal cusp. As I mentioned, there's a method for reading this. I'm just giving an example here in this live, but I want to highlight for you that the patient came in with a very important issue, sensitivity. What do you do with patients who have sensitivity but don't have any restorations to be done, for example? What do you do? Oh, I use fluoride. I do a laser protocol. Oh, I do. I don't know what you do. I'm just shedding some light here. And then many times you don't solve the patient's problem. You don't find out if this is related to bruxism or not, because it's not a mouth that currently shows many signs of bruxism, right? But if you have the differential diagnosis, you actually make her aware of bruxism, whether she has it or not, what it does, the level of her bruxism, whether it's mild, moderate, or advanced, and what else are you bringing? An increase in the average ticket from this patient who, in quotes, wasn't going to do anything, 1,250 reais. With integrity, yes, integrity. Integrity of what? Of diagnosis, of knowing the cause, of understanding the problems, of understanding where this patient is at. So 1,250 reais, folks. 1,250 reais with her doing the exams at home while sleeping. You understand that it's a great start, a great leap forward when you're tight on money, when you have a bunch of bills to pay, when your practice is barely breaking even. A new opportunity opens up here with bruxism. You can generate revenue very quickly with predictability, with integrity. You're not going to offer this patient a bunch of veneers. That's not what I'm talking about. I'm talking about delivering health, providing a diagnosis, actually giving her what she really needs. And look, this patient doesn't have apnea. The fact that she doesn't have apnea doesn't mean the polysomnography was invalid, that it shouldn't have been done. No, on the contrary, guys. When you take a test to find out if you have a serious disease, like do you have cancer or not? Do you want to have cancer? No, you don't want to have it. So it doesn't make sense. You actually want it to come back negative. I don't want it to show apnea, but I need to do the test because I can't know if the patient has it or not if I don't run the test. And it's precisely for this reason that we do these specialized complementary exams. So this is an exam that takes you to another level. The patient is already in your office. I mentioned exams costing 1,250 reais for patients who are already in your office. So I want you to understand this once and for all. And now come the questions about treatment. Today, the approach is related to differential diagnosis. What else do we see in her exam? That she snores. So, for example, sometimes the patient doesn't know she snores, but snoring is a problem. So, what type of mouthguard do you use for someone who snores? Is it the same mouthguard? Have you ever stopped to think about that? All of this is covered in the treatment section. The treatment pillar consists of 4 stages, and as I mentioned, within these 4 stages, there is the personalized mouthguard. So, I brought you different clinical cases here, each with a differential diagnosis approach. One has apnea, the other does not. One had wear on the pink paint, the other did not have this wear, considering the possibility of reflux. One had crater fracture syndrome and lost 2 teeth, while the other has almost all teeth intact. And both have bruxism. Do you understand what the profile is like for all the patients who will come to your office? After we complete this differential diagnosis, we provide a report to this patient. We provide a report to this patient, which is the 360 report, the DTC report, and within this report, we then begin the treatment, which is the next step. And Kempner managed to address this masterfully in his clinic over in Mato Grosso. I showed different regions, different ones, one in the capital, the other in the countryside. Kempner is from the countryside. So he managed to address this beautifully because he introduced it as a positioning value, with him being an oral and maxillofacial specialist. In other words, any specialty can encompass this. And he's different from the others. Now, what does he get? He gets a lot of patients from other dentists, often to make a differential diagnosis and to treat bruxism. Why? There are no references in his region. So in this next video, Kemper is going to talk about what's happening regarding treatment in his clinic, about differential diagnoses. It could be you. You could be the next Kemper. You could be that dentist who delivers results, who had a breakthrough, who became a reference in the region, and who has loyal patients. So I want you to listen to Kemper carefully, really thinking that you could be the next one. To give this testimony, to share this breakthrough moment.
There's a methodology that allows us to do this without much confusion, so that makes a big difference. Yeah, I don't hesitate to charge. I charge 5,800 now for a treatment, but I think the patients are accepting it. I think it's really good because there's a huge added value in retaining patients at my clinic who end up doing other procedures here as well. So that's what we have to think about. It's not just the price itself, but what does it add? I'm not just treating bruxism. I'm changing this patient's quality of life, which leads to patient loyalty. It's a super important tool. It's something that helps us work, and it definitely makes us a reference for bruxism treatment here in our region.
I can't serve the whole of Brazil by myself. I can't serve our entire country alone. I need you. I need you so that together we can truly make an impact on this generation of dentists. And for those of you who are just starting out in dentistry, even more so, you have to start off right. You need to see the patient from a 360-degree perspective. Now, another patient, Murilo, 42 years old, came in with gum recession. Another very common case, gum recession. How did the patient react? He accepted it. Thank you. He agreed to the exam easily. Yes, I'm talking about diagnosis. How much did he charge? Leonardo Padula, Rio de Janeiro, and also the countryside Petropolis. 1,100 Ries. The splint plus 3 days with the biologist. In other words, diagnostic package, 1,100 Brazilian reals. He's talking about the treatment issue down below, which isn't today's class topic. Now the patient arrived. This patient comes in with a differential diagnosis, charged 1,100 Ries. This patient has increased the clinic's average ticket with dental treatments remaining. When we talk about perceived value, it's that the patient, when they truly see you are different, that you ask questions no one has ever asked, that you have a methodology no one else has, you gave them a test to take home and sleep with. They're thinking about you for 7 days since they left your office, doing this diagnostic splint test and connecting it to what they do at night. They're paying attention. It's not just you looking at the test. They understand this test. And this patient then connects with you. What can you explain to this patient about their test? The contacts are wrong. Then the orthodontist says the contacts are wrong. That's a hook for you to close the orthodontic treatment right there. There's no apnea. It's great that they don't have apnea. Another hook to close the orthodontic treatment many times. This is a patient with a high level of stress. This is a patient with moderate sleepiness. This is a patient who has movement-related bruxism. A lot of contact on the anterior teeth. Now it's time to move on to treatment. And the treatment for this patient with bruxism, when you incorporate it, will very likely include orthodontics as well. See how it's the whole field? All areas of dentistry. It's not just bruxism. It's bruxism plus dental treatment, plus dental care, plus orthodontic treatment. The treatment that's necessary. Now, the last case I want to share with you is Sheila's. This case is super interesting. Why? This is a patient who also came in with gum recession. Gum recession, hold on a second. Very common. Gum recession, that was his complaint here. Look, that was his complaint. Now, another detail. Just to go back to the issue of gum recession that I forgot to mention to you. Gum recession, thin periodontium, there are a lot of abstractions really. He has sensitivity and his complaint is gum recession. Is it worth doing a graft on this patient with the bruxism like this and improper contacts? No, it'll come back. He'll have recession again. So be careful, because if you, as a periodontist, just address the immediate cause, the reason he came to see you, if you only treat the consequence of the problem, which is gum recession, sooner or later he'll come back complaining because the gum recession will return and you'll be seen as the bad periodontist, the bad surgeon who didn't actually treat the root cause and he ended up with the same problem again. So be careful about that. Now, getting back to gum recession, Sheila returned mentioning gum recession, a darkened tooth, number 11. It was an aesthetic concern. She used a professional self-ligating brace from Asteno, but it didn't fully solve the problem. When she heard about the diagnostic splint exam, she found it interesting, understood its importance, and readily agreed. The dentist charged 450 rays for the diagnostic splint. So our dentist was just starting out, this is Stephanie's case, confirmation of bruxism in the anterior teeth. She wanted to confirm whether the patient actually had bruxism or not. And I found her account really interesting, which is why I brought this case to you. The patient reports that she had a burnout before the pandemic, that she resigned from her executive position, and that today she dedicates herself to alternative treatments and therapy to regain her balance. Look how interesting, emotionally speaking. So just look at the level of self-awareness this patient has. She reports that she doesn't take medication for anxiety, which is great, but she has used valerian passion flower during the maintenance period and inusometicos, which are supplements. A dentist once told her she has bruxism, and she has used a mouth guard when she was more stressed. But now that she's calmer, she was surprised by the result of the diagnostic mouth guard. I found this account amazing. First, the patient had a burnout. Point 1. Point 2, I've never seen a patient object to doing a differential diagnosis and actually seeing what they do at night. Point 2, she did the differential diagnosis even though she didn't think she had bruxism because she was calmer and had quit her job. So she understood the importance of actually seeing what happens at night. It's not just a guess. I don't think you have bruxism. I want to see if you have bruxism or not. I want to see it for myself. So she did the diagnostic splint exam. Now remember that the patient complained about a darkened tooth. Look at this splint. Darkened tooth, root canal treated, bone loss. Whoa, be careful, periodontist, be careful, and occlusal trauma. Went at night while she's sleeping. Occlusal trauma at night while she's sleeping. So she doesn't take any anxiolytics. But there are a lot of patients who do take anxiolytics because we're living through a period of burnout in every profession. It used to be a luxury item, right? Not anymore, okay? Not anymore. It's too much screen time, too much social media, too much anxiety, and then people take medication. What does the anxiolytic do? It recaptures serotonin, increases serotonin levels, and also alters dopamine. And dopamine is responsible for muscle control. So there are a lot of anxiolytics that as a side effect, let's put it that way, right? The side effect is that it also increases bruxism at night, okay? So a loss of muscle control. Be careful with patients who are taking anxiolytics. You need to do the diagnostic splint exam. You need to make a differential diagnosis so that you can be sure whether the patient is clenching or not, even if there are no signs of worn teeth. And now what I want to share with you about Sheila, specifically about Sheila, as we wrap up. If you just go by what the patient says, she's not working anymore, no more burnout, everything's fine. I'm going to treat her bone loss surgically. Guys, the tooth is under trauma at night. It won't last. Nothing you do here will last. And then many times you have a surgical failure, an endodontic failure, a restorative failure, and you don't realize why. And the diagnostic splint is showing you why. Because there was an occlusal overload exactly on the spot you treated. So the differential diagnostic splint exam gives you much more than just knowing whether the patient grinds their teeth at night or not. It shows you where the greatest point of tension is at night. It reveals the patient's connection with what they do at night and their adherence to treatment. It reveals the type and intensity of bruxism, which will also guide your treatment. So the diagnostic package, the differential diagnosis that I just presented to you, is a real game changer. It is a game changer in the life of any clinical dentist, regardless of their specialty. And if you plan to keep practicing for the next 5 or 10 years, I need to tell you, this is the profile of the patient who will come to you, because this is the profile of the population and it's only going to increase. Now, if you want to be a leader, someone who makes an impact, who understands, who brings quality of life and becomes a reference in your region, then now is the time for you to dedicate yourself. Now is the time for you to make a commitment. What level of commitment do you have to this field of dentistry? What level of commitment do you have to your patients? What level of commitment do you have to yourself? Because this is for you to reflect on yourself. Look at day 3 of the flood. Maybe you yourself are grinding your teeth. Maybe your family is grinding their teeth. So this is the moment for that connection, to become that reference dentist, to return to your roots, to be a 360-degree dentist. And I brought up Lucia's case. Lucia is an orthodontist, and she was dealing with a lot of issues, noticing bruxism among her orthodontic patients. Maybe you are an orthodontist and are seeing this in your own practice. And Lucia saw this too. And then she was able to add value for her orthodontic patients right there in her orthodontic practice, which allowed her to stand out in a very honest way. And of course, she also earned some extra income from treating bruxism, which wasn't originally part of her scope since she only did orthodontics, and bringing in new people so that she could connect through something that very few orthodontists understand, know about, or are able to diagnose in a unique way, which is bruxism. So bruxism also goes hand in hand with orthodontics, but in a unique way. How did Lucia Maria deliver this within her orthodontic practice? How did she add this to the life of the orthodontist?
My name is Lucia Maria Cavalcante. I live and work here in Sao Paulo, the capital. In dentistry, as a dentist, I have been practicing for 12 years and I specialize in orthodontics. I also do general practice, but my main focus is orthodontics and, nowadays, bruxism, because of the high demand. Before I learned more, working as an orthodontist, what used to bring me a lot of doubts was when patients would come to the office with pain. I would see that dental wear, and the patient already wanting to start orthodontic treatment, and that bruxism had a cause related to the nervous system, to emotions. That was it, So, I would always talk about bruxism, that we would have to treat it, and already, but I would always focus on the orthodontics, but with a lot of insecurity. Will they have pain during the treatment? Wouldn't it be better for them to treat the bruxism first, start with a mouth guard, or refer them for some kind of treatment, maybe see a gastroenterologist, or get psychotherapy? I had a lot of doubts, I was on my own with this. And afterwards, I started applying it right away, and I show them how I managed the control, the treatment, I show more authority, more knowledge. I don't need to refer them to several different specialists at that moment. And more, I offer more and I close the deal. I closed several diagnostic mouthguard cases with patients who came from insurance. And with that, I got an extra income, an additional earning in my practice, Because besides orthodontics, I also do this treatment by selling diagnostic mouthguards, and it really boosted the clinic's revenue.
Very interesting. She, in a predominantly orthodontic clinic, felt insecure because the patient would come in for orthodontics with worn down teeth. Do you know what that means? Integrity. That is integrity. Because when you are concerned, the patient has worn teeth. Am I going to interlock these worn teeth? Will they have a bruxism episode or will they not? You are concerned about the patient. If you are the kind of professional who cares about the patient, this is the place for you, without a shadow of a doubt. Now, she managed to add to that by selling a differential diagnosis, selling diagnostic plate exams, increasing an income that didn't exist before, a path that didn't exist before. Within the concept of bruxism, she's able to organize things and not just send the patient everywhere, sending them to the gastroenterologist, sending them to someone else, and so on. Why? As I said, methodology, step by step. Step 1, do this. Step 2, do that. Step 3. So it's not just a bunch of random things. That doesn't work, a bunch of random things. In the life of a dentist who works all day, they'll never be able to organize all of this and put it into practice. And it's precisely because of this organized application that she's been able to get results. Because she understood the methodology, she studied the methodology, she applied the methodology, and now she already has results. Financial results. Results in the clinic's turnover, because she no longer loses orthodontic patients out of fear of treating bruxism or because she thinks she has to put in a splint before starting orthodontics. She understood that this isn't the case, that you treat bruxism together because there are the correct steps. And from that moment on, she can move forward with the patient confidently. This is the key point, clinical care safety. Tomorrow, in lesson 3, I will go deeper. I will explain the details. I will explain the details of how to close a bruxism treatment and I will explain the details of the course, the details of each module, what's in the course, how you, and all of that. Tomorrow in lesson 3, what will happen in each of the steps, okay? So I'm waiting for you tomorrow in lesson 3. Thank you so much for staying with me until this hour. Together we will become a reference, yes, without a doubt, and change the reality of this country when it comes to dentistry. I want you with me. I can't take care of everyone. I can't serve the whole of Brazil. I need you in your region. Make this commitment to yourself, to your patient, to this new dentistry that is already there in your office, already there in your chair. Kisses. See you tomorrow in lesson 3.